I remember when I heard the big C word, learned I had cancer in multiple places. I was so afraid, scared me to death. But for about 3 years now, there's been no reoccurrence for me. And for that, I have deep gratitude. And during these 3 years, I've read, I've listened to lots of speakers, I've talked with other persons, and I've learned a lot. And so I thought in the next few videos that I make for you, I'm going to summarize some of what I've learned. And it's been fun for me to realize that a lot of the topics that I'm going to present to you start with the letter C. And last night when I was counting all the C words that I was going to try to make some sense of for you and put into this series of videos, there were about 55. And so I tried to sleep, and this concept was on my mind. And I was happy to realize that all the C words that I'd listed, that I'm trying to group meaningfully, I hadn't listed chemo. So that made me feel pretty good that from the beginning to 3 years later now, the word chemo wasn't on my list of C words. So we'll start with part one, and we'll continue to summarize C words to talk about the challenges of cancer and how to, what I would say, cancel cancer out of your life. Now you can see there are many types of cancer treatments, and these are some that I've experimented with or read about or experienced. But what I really want to talk to you about is about calming and the miracle of healing. Now, even though we have all these different therapies available to us, as an educator, I like to cross out of the typical cancer or oncology therapies. And what I've really come to enjoy and appreciate is persons that study the mind-body, persons that study the brain. There was a gentleman, David Butler, who just spoke on Maya Novik's World Summit that I've talked about quite often. And he talked about DIMS and SIMS in our brain. And he talked about, our brains, the DIMS he described as where we feel danger, we might hear or see or smell or touch. And that gives us concern about our various illnesses. In my case, it was cancer cells. In other cases that he was talking about, it was persons who've had injuries. Well, certainly multiple surgeries, I think, could be considered an injury to one's body. So I appreciated his perspective. He talked about SIMS, and those are a network in our brain that give us safety. So for SIMS, he was talking about where people talk about the blue sky or kisses or cuddles or touches or smells or colors or textures, these various brain constructs. So what I want to talk about in this first part is that mind-body connection, our brains, what we do for creating cortisol in our system, what cognitively we can control, and the choices we can make that can calm us. Another speaker in the Maya Novik Summit talked about what kind of coper are you. Now, this was Erica Milo, and she said, some people are good copers and some people aren't so good as copers. I would hope that I'm a good coper, but that again lets me think about healing, visualization, imagery, mindfulness. So personally, this is the type of therapy that I've found the most useful now that I'm 3 years out from my various surgeries that I had for the cancer. Dr. James S. Gordon further continued to talk about mind-body medicine and getting to know our bodies again, making friends with our body, not feeling angry at our body like it's the enemy because it's changed so much. Mourning, perhaps we mourn the loss of what we thought we had, but also calming ourselves with memories that give us pleasure. I'm so happy that I'm still alive. And every day, that happiness makes me want to pay back to others in every way possible, which is why I keep making these little videos for you as I learn and read and discover. Um, I have maybe survivor's guilt because at least 7 persons have gotten cancer and have died. They've passed away since I was diagnosed. And that's a little bit hard sometimes for me to deal with because I don't quite understand why I'm not having a recurrence, and other people have not only had recurrences, but they've passed away. So I want to wrap this up. I don't want to be too long on each video, but in summary, the choice I've made for myself for treatment is to focus on mind, body, and in particular focus on the brain. Heidi Armstrong just talked about our sympathetic nervous system and our parasympathetic. And the sympathetic nervous system is like the gas to our system. And the parasympathetic can be seen as the brakes. So I'm interested in knowing how to put on the brakes to continue to heal and to continue to be healthy. And in this case, to meet the challenge to cancel cancer. Now, I'd like to ask you, of all the C words that you can think of and the C words that are flashing on the screens and as a ticker on these videos, I'd like to ask you, what C words can you think about for yourself to cancel cancer? Blessings to you.